so excited to be here with the Bur Oak Foundation at the Detroit Institute of Arts. Mary Blazek and I met at the Harvard Macy Institute for Art Museum-based health professions education, and this was a fellowship that we participated in, and it just got us incredibly excited about the potential that the arts and humanities and a museum-based teaching has for medical education.
Yeah, and the wonderful thing about coming into the museum space is that learners and providers and physicians and nurses lose the hierarchy and lose the thinking that they use in the clinical setting, and they know that here they can be more open-minded and reflective and share. And we use evidence-based methods to engage with pieces of art, not about them, but in conversation with them, to demonstrate different perspectives, bias, tolerance of ambiguity, all kinds of benefits.
Yeah, I think a lot of people, when they think about using the museum to teach medical students, they're thinking about looking closely and observation skills, things like that. And that is certainly one skill that the museum can teach and students can learn from. But more importantly, I think students have an ability to reflect, to develop personal insights, to appreciate other people's perspectives, and to think about how they might use their own values and virtues to advocate more for their patients.
When I saw this photo, I wanted to join it. I wanted to be a part of this scene. And I think if I was to go on a date with a piece of art, I would want it to be this piece of art. I would want to go here, join these people, find out what makes them so joyous and wonderful.
We are a group of medical students from the University of Michigan, and we just spent the morning with the Bur Oak Foundation at the DIA, the Detroit Institute of Arts, with Dr. Meg Chisolm, who was giving us a tour of the museum and reflecting a lot on how how studying art can really inform our practice of medicine.
So there's the obvious close observation and communication skills that having discussions around art and looking at art can build, but more importantly, I think, are the higher level skills, the metacognitive skills, where people learn to think about how they think, and they also can develop critical reasoning skills, which is really important for clinical reasoning, of course, where somebody has to make an interpretation based on evidence, and this visual thinking strategies really encourages people to ground their interpretations in visual evidence, which is important for doctors, of course, of all kinds.
I had a remarkable 2 days with the Bur Oak Foundation, and I'm so grateful to have been able to listen to and learn from my peers and colleagues and Dr. Meg Chisolm. My undergraduate thesis was about Jean-Francois Raffaelli, who was a little-known 19th century French impressionist, and he discovered the theory of characterism, and he really wanted to display the reality of the individuals he painted. They were often the forgotten individuals of society. And I often think about him in my work with my patients. I want to depict their reality, whether I'm in a clinic or in the hospital. And for better or for worse, through medical training, I have lost a little bit of that and don't get to interact with that as much. And so this was a true reminder of why I went into medicine and the importance of depicting my patients' realities. So thank you.